I'm kind of looking forward to hearing Heather talk. If you remember, we talked about Heather Uzzle earlier in the week. She is working at a long-term care facility, a nurse there, and had contracted COVID-19 and has now recovered and had the strength to go back to work, which I think is awesome. So we appreciate you being here and telling your story.
All right. Thank you so much, Judge Executive and Mayor and our fellow healthcare worker, for the invitation. I do count it as an honor to be able to share with you my story, and also to kind of shed the light a little bit on the misconceptions that we sometimes have with this virus. One of the things that I know that is always prominent in the news and kind of that is brought forth is that this is a virus that primarily preys on our elderly. Also, it's for those that has those underlying medical conditions. Both of those facts are very, very true. But in my case, I didn't fall into either of those categories. I had no underlying health conditions. I'm not in that elderly bracket. And as it was already stated, I am a healthcare worker. I am a nurse that is in a long-term care facility and that is working very closely with our local and state health departments. We are following all the guidelines of the CDC and our OIG entities. And as a nurse, I was using all the protective and required PPE that was required for every task that I did. After I had worked a particular shift and was sometimes as nurses we work so many days on and then so many days off. At the end of my shift for that particular week, when I was made aware that I had been exposed to the COVID-19 virus, myself and my family immediately, okay, and I think this is the key point that I want to really stress to everyone, we immediately made all of those necessary changes. I wasn't showing symptoms at that particular time. My family, my husband is a diabetic, so I knew there was a necessity there for me to make sure that I safeguarded him. We have 2 children. Travis is our oldest, and he works outside of the home. He actually moved out whenever I told my family, that I had been exposed to this situation. He moved out into an apartment so that he could continue to work. We sat down, talked to our daughter, Caitlin, who's our youngest, explained to her kind of that mom had been exposed, that we was going to have to do things different in the house. She wasn't going to be able to get as close to me. And all of this was still at a time when I didn't have any symptoms. I just wanted to take this that serious because I had seen what this could do for someone. So we talked to her, made sure that she understood. She we have a 2-story house, and she would stay downstairs most of the time. I went at that particular time and stayed in my bedroom. We have a bathroom in our bedroom. My husband took all of his things out of our bedroom, went into a spare bedroom to stay. I had finished, like I said earlier, my actual work schedule that week. Thursday, I'm a third shift nurse, so Thursday I had slept. I had gotten up that day, though, that evening. I had been told that I'd been exposed, and I started just maybe not feeling as energetic as I normally do. I kind of thought that was be contributed because I had just worked, all of those scheduled shifts. So I thought that fatigue could probably be from that. So I went to bed that night, got up the next morning. Then I had a cough, and then I had a slightly elevated temperature, and then I started having aching and a sore throat. So at that particular time, I was getting concerned because I knew I had been exposed. I was still doing all the proper things in my household to make sure that I safeguarded my family from the situation. At the next day my husband he was so gracious, had brought me, him and my daughter had made, I think it was chocolate chip cookies. And so he had came to the door, knocked on the door, and told me, there's cookies out here. And so once he walked down the hallway, I had put my mask back on, opened the doorway, and had got the cookies. And he was standing on our staircase. And I said, well, these look really, really super good. I said, the only problem is I just wish I could smell and taste them. And once I said that out loud, it was like it resonated with me that I was checking all of those boxes for those symptoms at that time. I immediately called my administrative at the facility that I worked for. told them that I was going to be, this was a weekend time, so I was going to be going to get that testing. I went for a Monday morning, drove to the facility that I got my testing from, and as a healthcare provider, a worker, the one thing that everyone knows, it's not a secret, we are not sometimes the best patients. So I drove up, I had my mask on, my fellow healthcare workers came out and started telling me, what that they was going to do. And I stopped them mid-sentence and I said, I honestly know what you're fixing to do. I'm a healthcare worker myself. I've done this test. I understand what it requires. I don't want you to talk to me about what you're going to do. I just want you to do it. So I can remember I, leaned my head back for them to administrate the test and closed my eyes because I didn't want to see what was actually coming. But the thing that resonated with me at that particular time was that I was taking control of my situation, that I was getting that testing done for my family. My family is the most important thing to me. Not only that, for my fellow human beings, for my workers at my facility, for my residents and patients that we take care of. So that was on a Monday. I went back home, went straight into my room, barricaded myself in there, made sure that, everybody understood we can't, do any kind of being beside of each other in any facet. Wednesday morning, I got the call. And as soon as I got the call, even though I knew that I probably did have this, I'm not going to lie. That was when the true test started. And I understood what this virus was. I understood the difference that I was going to have to make in my own family. I called my husband immediately and told him, who he was in the other room down the hallway. He called, told our son, talked to our daughter, and we had to make sure that right then that we made all those necessary changes. I'm a strong woman of faith, and I truly do believe that prayer changes things. And I had so much outpouring from my church family, other faiths, denominations that reached out to me with prayers. And I do feel like, and I contribute that to my recovery as well, for that prayers and support. And I thank those people for doing that. But the main thing that I want to say about this situation is the support. And it is so, so vitally important that we reach out to those persons that are in quarantine, that we make sure that we reach out to those family members that are taking care of those persons that are in quarantine. You have to make sure you make those necessary changes and you make sure that you get that support. My parents reached out to me every day to make sure that they checked on me. I had other family members. I had a sister-in-law who sent me some of the funniest videos that I'm going to have to use later when this is over, probably against her a little bit. I had a friend who absolutely called me every single day like clockwork. She offered to bring over things to drop off on my porch. That was a vital part of my recovery, for, as we heard earlier, for that mental capacity for me. We had a neighbor who brought over food one evening, left it on our porch. My work family reached out, sent me a Easter basket, left it on my porch, which was such a nice surprise. But that was something that I was dealing with every single day, and that's what I had to do in my own setting. And let me tell you, I'd already started to separate myself in this situation before I ever knew that I was COVID positive. Once I knew, and I knew that I had to stay in there, some people had told me before, thank you so much for that sacrifice. And yes, it is a sacrifice, but I was thinking one day, particular evening when I was in my room and was listening to my family, I could hear them outside of my doorway. To me, that was an act of love for my family. I wanted to make sure that I kept them safe. I wanted to make sure that I'd done the proper thing by staying in a different area and to get over this COVID virus so that I could go back to my facility and help out and make sure that I was safe for my residents and for my patients. The thing I don't want to leave out, though, in this particular thing is people reached out to my husband. Our whole family dynamic changed at this particular time. He now is the primary caregiver to our child. He had to, cook, learn to make new recipes. And that's one thing that I was teasing him. He would bring things to my doorway and knock on it, and he would say meal 1, meal 2. He would count, all the meals that it was and snacks and things. And I remember one particular night he had knocked and he had brought me, I think, an orange and some water or something. He said, meal 7, I think. So, but people reached out to him, and he made me very good things to help me to recover physically as well. So I really want to stress the fact that you need to make sure you support those that are in quarantine. Make sure that you support those family members that are going through it as well, because it's a totally new normal that we're having to deal with in this situation. When I was actually cleared up at the end of this, the first week was probably my roughest as far as how I felt. Okay, and being a young person and didn't have those underlying medical conditions, I was very fortunate that I was in a good health state to begin with. So the first week was my roughest week. The second week, I was feeling better. So that support was really key in that time, because I was, ready to start doing more normal activities in just my own household. I did have a routine, which was very great that you had brought that out. Every single day I got up and got ready. Every single day I opened my blinds. Every single day I found some type of task in my room. I said, my room is now the cleanest room in our whole entire house, to make sure that I did, just to give that normalcy to my day-to-day activities. Once I was cleared to go back to work, though, I was so overwhelmed, okay, because you have to think I had been out of the actual facility for a couple weeks there, a little bit over that actually, of the community support that we had when I returned. It was absolutely astronomical that our community had bonded together as a team. We had other healthcare systems that brought things to us. Our faith community reached out. We had families in the community that covered us with prayer, with food donations, drinks. They donated PPE directly to our facility. They gave us cards that actually was very instrumental into our well-being as well. The first night I went back, we watched, whenever I was in my room, I would watch every day, you guys. I would also watch the governor in the evenings. And one of the things that I know that he talked about quite often was the strike teams. So that Monday night when I went in, I got to actually meet those strike teams that was there, which I kind of reworded and called those our angels in disguise. And they were so instrumental. And if they're watching, I definitely want them to know we appreciate everything they did. We were so excited to have them, and they were so gracious to come and be with us in our time of need. The thing as a healthcare nurse that I would like to bring forth, though, is that this virus has changed the way that we even have to look at our situations in our facilities. One of the things when you're trained as a nurse is to be an advocate for your patients. And the fact that in some of these situations we are not able to have those family members present on a daily basis, what I would like to say to those family members is the fact that they reach out to us, they reach out to their family members and, send cards. Grandchildren send little coloring pages that they've done. They actually FaceTime. And, we are serving our elderly community who are not as tech savvy. So they are so excited to learn about this FaceTime that you can do, and they can see their family member, and they light up. These family members light up this resident, our patients, day when they do that. That phone call we make, we put them on speakerphone. They can talk to their loved ones. It has absolutely been a vital part in their recovery as well. The one thing that we try to do as nurses is we try to bring out that positive every single day to our patients. I think we have enough negativity that comes around to us as healthcare workers. We also deal with it just on the medical aspect of this. But every single day we celebrate those milestones, whether it's eating a little bit more, a temperature that's not as elevated, and we celebrate those things with our residents and our patients. We become creative in our methods of bedside manner. I said I've probably danced in more rooms this last week than I ever have, just to bring a little laughter and sunshine into someone's day, because we're all having to get out of our comfort zone. The thing that I'd like to leave with you today is, though, is that we all need to take responsibility for our own individual self. We sometimes want to point fingers, I know, in situations of this magnitude, and to say, if this had happened different, if that had happened different. We are all individuals that have a responsibility, if we have those symptoms, to make sure that we get checked out, we get tested. We need to honor our social distancing, take the advice of those that's in authority over us to make sure that we follow those guidelines that are just for our safety. And I think about the fact that what you do each and every day could be the difference between someone living and dying. And that's the thing that I want to leave with us, is to know that we can make a difference. We are making a difference, and we are going to get through this. So thank you so much.
Heather, we are so thankful that you are here with us today, that you have you've recovered from the COVID-19, and you're here to tell us the story of how that has affected you, it's affected your family, and then how it has affected the workplace.
And the strength to go back to work after that. I mean, I just thank you for that.
So, question, Heather, how important is the PPE for you as a frontline healthcare worker?
PPE is what it is protective wear. So I feel like it's kind of like going into battle, actually, and it is what protects us against this virus. I kind of try to look at it each time I put it on, that each item that I have to put on is actually represent a life that can be saved by applying that item. Okay, so each and every piece that is donated, that we have to put on, that we do to tend to our residents and our patients, represents a difference of someone living and dying. It represents the difference of what we will take home as a healthcare worker to our families and our communities. And it is so important, and we need the amount that you go through on a normal shift is unbelievable, because this is something that we have to make sure that we change very regularly. We have to, and you're very hot in this stuff, so you're having to change it because, of the perspiration that you're doing and things of that nature. So it is it's not just a vital thing. It is a thing that you have to do in order to save someone's life.